Welcome back to the Humble Healer podcast with Dr. Quang Le, family physician. And today, first, thank you for tuning in. And today we'll be talking about part two of menopause. And last week we talked about the science of menopause and symptoms and signs and what to expect and to raise awareness about menopause. And today we'll talk about the treatment. And then on the next part of this series, I will be interviewing a patient that is going through menopause right now with very uncomfortable symptoms, and I will have her tell you her experiences and perspectives about how that can be very affecting her life and quality of life especially. So I hope you look to join and check out that episode. Treatment options. The first one is menopausal hormone therapy, used to be known as hormone replacement therapy, HRT, now MHT, and is the term that we use for hormone replacement and supplementation. And this is regarding estrogen and progesterone, which the hormones would naturally decrease during menopause transition. MHT can come in the form of pills, creams, transdermal patches, vaginal rings, or even a hormonal IUD. And it started in 1940 when U.S. scientists developed the estrogen pill, Premarin. And however, the first formulation of Premarin failed to include a sufficient amount of progesterone, the hormone that protects the uterus lining. As a result, the 1970s saw a sharp spike in endometrial cancers. Pharmaceutical company now revised their formulations. Um, However, in 2002, big study by Women's Health Initiative cast new doubts that show an increased risk for breast cancer, coronary heart disease, stroke, and pulmonary embolism or lung clot. So after that, the use of hormone replacement therapy plummeted. However, today we know that these was exaggerated the risk. And when the data was reviewed in 2007, a different picture emerged, and it showed that overall life expectancy was the same for women on MHT. And actually, those who started MHT within 10 years of their final menstrual period actually had a decreased risk of coronary heart disease. So now they came up with an idea of a window of safety for MHT to recommend for patients. And in this window, meaning before the age of 60, MHT can be very useful. And despite a slightly increased risk of stroke, blood clot, and breast cancer, it can significantly improve hot flashes, insomnia, and hormonal depression. And also, so the windows now, they don't recommend the use of MHT for more than 5 years. And by then, almost all women or most women will be done or have already adjusted to menopausal symptoms, basically moving on with the new changes in their life, the life after menopause. So how do you get started with MHT? Start with the lowest effective dose that can help with your symptoms. And with estrogen, transdermal applications such as cream and patches are lower risk than oral medications. And progesterone, however, isn't absorbed as well through the skin. And also make sure that you steer clear of the compounded or natural products since they are untested and unregulated. And also natural supplement mix that claim to deliver bioidentical hormones. Again, not very regulated, so we don't know exactly what we're getting. Sometimes hormonal therapy can take up to 6 months to take full effect, so make sure that we curb our expectation, and especially for women who are going through this, and it also might simply not work for your symptoms. But when it does, it can be a very useful tool in the menopause period. And also, a lot of women will wonder whether that can help with the sex life during menopause, and it's definitely can help improve that also, because during menopause transition, the women's genitals also change with the vulva and vagina become thinner and shrink, and used to be called vaginal atrophy, but now there's a new term, and it's called genital urinary syndrome, or GUSM, genital urinary syndrome of menopause. And this is more accurate because it affects the bladder and urethra also, and it just sounds so much less horrifying. GUSM is perfectly normal, and over 80% of women experience it. Still, some people find that it impacts their sex life, so they might find it harder to achieve orgasm as their genital gets smaller, and also the vaginal microbiome changes, and it can lead to dryness, itching, and pain with intercourse. So vaginal estrogen and a hormone called DHEA are proven to work well for GUSM, and also have been found to treat recurrent UTIs, which is another common complaint during menopause transitions. In addition, you can cleanser, lubricant, and moisturizer can work wonders for these vaginal symptoms of GUSM, and they recommend using a cleanser instead of soap to protect the pH balance of the vulva, and a cheap facial cleanser can do the trick. For moisturizing, coconut oil or petroleum jelly are also very helpful. Another non-medical treatment that is very helpful is Kegel exercises, and this you can learn easily from looking up on YouTube. And this will help strengthen the pelvic floor muscles and can help increase pleasure during intercourse and improve the orgasm. Also, it can help with urinary incontinence, which many female patients experience after menopause. Another side effect of menopause, or not side effect, but another effect of menopause is decreased libido, and it is due to also hormonal change. So if this is a problem, then MST can be helpful. But if it is related to depression, then you should seek help with primary care or mental health professional. MST and an antidepressant, bupropion, can help with both hormonal depression and a low sex drive. And also try communicating with your partners and help them understand what you're going through so they can understand, so that to remove any misunderstanding about the sexual desire. Perhaps the couple will have to work a little bit more in order to achieve the same sexual pleasure as in the past. So main take-home points for menopause is that the more you understand and know about your body, the changes that's going through, the better you'll be able to choose the right treatment for you. And which include no treatment at all. And MHT can help with many symptoms, but not without risk. And the best thing you can do for your hormone, for your menopausal health, are those that benefit your health overall. And we talked about this plenty in previous episodes about smoking cessation, getting regular exercises, eating a healthy diet, activating the rest and digest system on a daily basis. Quitting smoking is also a no-brainer. We talk about avoiding ultra-processed food, eating a lot of whole grain, veggie, fruits, and fish and seafood, and so on. For those who suffer a hormonal depression, you may consider cognitive behavioral therapy, which can help you manage uncomfortable physical and mental health symptoms, and also hot flashes. So let's return to the Dutch word overgang to describe menopause as a transition from one stage of life to the next. And it will be a bumpy ride, but it does not last forever. Eventually, your body and mind will adapt, and armed with this knowledge and tool, you can be healthy and happy throughout and after the process. If you have any comment and feedback about the show, please leave me a feedback and what you have experienced through menopause and what tricks you have found that can be helpful to improve your quality of life during menopause. Please leave me a comment. Thank you, and please subscribe to the channel and hit the like button and the bell notification. Take care and have a wonderful day.